Welcome to the Infliximab Marketing and Sales section. My name is Catherine Godrega, and I will walk you through the key elements that made Remicade a blockbuster drug. Let's start with the commercial strategy. Four strategic pillars led Remicade from a small orphan drug to a multi-billion-dollar drug. The first strategic pillar is the addition of new patient populations, and more specifically, patient populations with higher disease prevalence. Remicade is also the only anti-TNF approved for use in pediatric population. The second strategic pillar is the optimization of the geographic coverage. J&J outlicensed Remicade in territories where they had weaker presence, and they also set up a joint venture in China. The third strategic pillar is the expansion of patient value through earlier diagnosis. Basically, if you can reach a patient earlier in the disease journey, the overall revenue per patient life is increased. J&J did it by increasing the awareness of the different indications by educating patients and physicians, as well as actually proving that the use of Remicade earlier is actually beneficial for the outcome of the patient. And the last strategic pillar is the price increase. So if you recall, sales equal volume multiplied by price. So to increase sales, you can either increase volume or you can increase price. And J&J actually played on both the variables, especially in the US, where listed price increased by 87% between 2000 and 2014. This commercial strategy translated into an annual average growth rate of 25% over the past 14 years and made Remicade the second biggest anti-TNF, reaching $9.6 billion in sales in 2013. Let's look at how it translates into a sales curve. As discussed earlier, the first strategic move was to add new indications. The most important one was rheumatoid arthritis, which accounts for most of the sales today. But the other indications are important too, as they allow to continue to grow sales. The second strategy was to optimize geographic coverage. So in Europe, for example, J&J outlicensed the rights to Remicade to Merck & Co. as early as 2000. In Japan, to Mitsubishi Tanabe since 2002. And in China, J&J set up a joint venture with Xi'an in 2008. The third strategy was to expand patient value through earlier diagnosis. So how did J&J do that? Well, basically two ways. The first way was to increase awareness of the different diseases among patients and physicians. So, for example, the Interstate movie, which was financed by J&J, showed the patient journey of patients who had psoriasis, Crohn's disease, or rheumatoid arthritis. But they also invested a lot in commercial campaigns, and we will review this in more details. So the second way that they expanded the patient value through earlier diagnosis was that they showed through clinical studies that Remicade could be used and should be used in earlier stages of the disease, and especially in Crohn's disease and ulcerative colitis, and that actually the use of Remicade may delay surgical intervention. The fourth and last strategy was to increase price, so to grow sales by increasing price. So this is only possible in the US. However, when you know that 70% of the sales are made in the US, the ability to increase sales is significantly going to impact the sales growth. So here you can see that in 2000, the price of Remicade was, the listed price of Remicade was $482, and in 2013 it went up to $900. Another way of looking at the key elements that made Remicade a blockbuster drug is to analyze its SWOT. So let's start with the strengths. So the most important one is that Remicade is first in class and best in class in the anti-TNF drug class. It's the first drug ever approved for regression of a chronic disease, namely rheumatoid arthritis. It's also a drug that has a significant number of years of clinical data of efficacy and safety from millions of patients. It also has a strong brand equity that was basically made possible through a very good understanding of patient journey and basically superior communication. And we will review this in more details later on in this presentation. Then the next point is that Remicade has a strong reimbursement position, especially with Medicare. It's also an intravenous formulation, which allows for rapid response in rheumatoid arthritis. Remicade is also considered as a gold standard and comparator drug in Crohn's disease. And as other anti-TNFs or the anti-TNF drug class has become a standard of care for RA, well, Remicade is also benefiting from this. And finally, Remicade is the only anti-TNF approved in pediatric population. So now let's look at the weaknesses. So the first one is that Remicade has a black box warning for risk of infections, tuberculosis, and cancer. So this black box is actually shared across all the anti-TNF drug class. However, of course, the other drug classes may not have this black box and may actually be at a significant competitive advantage. The next weakness is that Remicade is less convenient than other anti-TNFs for two reasons. So the first one is in some indications, either in RA or in Crohn's disease, it needs to be administered with another drug. And then the second reason is that Remicade is an intravenous injection, which needs basically a patient to spend over 2 hours at the physician office. So versus, of course, a much more convenient way of administration, which would be the self-injectable competitors, Humira or Enbrel. There's also in RA dose escalation often required, and there is a perception that there is a poor ability to maintain response in RA. Finally, because Remicade is a chimeric antibody, there is a belief that there is a higher immunogenicity with Remicade versus other drugs. So this last weakness is actually going to bring us to the next part, which are opportunities. And the first opportunity is actually to clear this chimeric antibody disadvantage, because there is a test that came up in 2013, the ANSWER test, which actually cleared the chimeric antibody and proved that patients on Remicade produce just as many antibodies as patients on Humira. So the next opportunity is that actually Remicade could further expand the indications to include other indications. Another opportunity is the barriers to the development of biosimilars. So we can see, for example, with the example in Europe, that payers and physicians are actually cautious about switching existing Remicade patients to biosimilar. And of course, Remicade has a long track clinical data that biosimilars are not able to match. So this is a significant competitive advantage. So even though there are opportunities, there are also threats. So the first threat is that the anti-TNF space is pretty crowded. There are very serious rivals of Humira, Enbrel, Cimzia, and they share a lot of the same indications as Remicade. And then there's competition that comes from inside J&J, which is the second generation anti-TNFs, Stelara and Simponi. So another threat is actually it's an external threat, and is the increased pressure on cost effectiveness from governments, because biologics are very expensive, and there may be other ways, other treatment possibilities. Then, of course, other anti-TNFs offer better dosing regimes. So we have already discussed about the self-injectable Enbrel and Cimzia. And of course, there is a very serious threat coming from biosimilars. So there is already one in Europe that's on the market. There is another one coming. There is one in India. There are 4 that have filed in the US. And there are new oral small molecules that are coming from some of the indications that may compete seriously with biologics. Now that we have reviewed the SWOT analysis, we can look into the 4 Ps. And let's start with the place. So there are many ways at looking at the marketplace. Remicade competes with other drug classes as well as the anti-TNF drug class. So here I will specifically focus on the anti-TNF drug class. So the global anti-TNF drug class accounts for around $32 billion in sales in 2013, and Remicade is the second player with 30% market share. So now let's look at the product. So what is the product? Well, it's first in class, it's best in class, it's an anti-TNF, IV injection, chimeric, many indications. Posology is weight-based, induction at 0 to 6 weeks, maintenance at 8 weeks. There is around 25 immunogenicity. This is what we can find through the Anser test. The main competitive advantage is the length and breadth of the clinical data. So one of the particularities is the co-therapy, either in Crohn's disease or in array. Actually, the drug is really good with patient support, with reimbursement issues, but also with patient education. The next P is price. So the price is actually there is a price parity with other anti-TNFs. So in the case of Array, it's around $19,000 per patient per year. There is a prior authorization that is required, but usually the drug is well reimbursed. In China, it's the same price point as in the US per patient per year. However, the drug is cheaper per 100 ml. But what happens is, and this is something we have discovered with Yang, usually Chinese patients weight less than American patients. So even though the drug is more expensive per 100 ml, because they weight less, they require less drug. So hence, actually, the overall cost ends up pretty much the same. In Europe, the price is around 30% less expensive than in the US. And unfortunately, we're not able to find the information for Japan or other emerging markets. So the last P is promotion. So who do we promote to? So first of all, we promote to physicians. So there are 2 ways to promote to physicians: indirect way, through key opinion leaders, through medical publications, or you can directly go and talk to them. So you would do this through medical sales reps. So I believe that there are probably around 100 sales reps per indication, because we're going after specialties. So if there are 8 indications, there's probably anything between 600 and 800 sales reps for Remicade. So the next the next promotional target are the patients. And basically the patients, they listen to direct-to-consumer advertisements. So this is what we'll see into more details, but the DTC campaigns are linking symptoms, for example, gastrointestinal symptoms, to condition, which would be Crohn's disease, to solution, which is Remicade. And they would usually make sure that the patient would ask for Remicade specifically. So the third promotional target are the hospitals. So what's very important for Remicade is to be on the hospital formulary. So within J&J, there is probably a managed care department whose only purpose is to basically deal with this. And finally, advocacy groups. Because what you want to do is, so it's not about Remicade, it's not about the brand, it's more about raising awareness about the different diseases. And here, basically, J&J is going to promote awareness of the different conditions through, so for example, we have already discussed the Interstate movie, but also webinars and other patient education materials. So, the third way of looking at the commercial strategy are the 4 Cs. So let's start with the consumer. So who is the consumer? Actually, there are many consumers. Let's look at them one by one. So the first consumers are the physicians, so the specialty physicians. The second consumer are the patients. So we have seen that they have different indications. So there are different patients. They all have all different diseases, and they are adults and there are children as well. Then the third consumer are the payers, the government. So here you have to sell them the health economics, which actually, as we have seen with Kavita, it's not that good. So it's all about improved quality of life, but also first mover advantage, because as there was really nothing else on the market at that time, having the only drug that could actually change significantly the quality of life of those patients allowed Remicade to for broad managed care access. And of course, the last consumer are the advocacy groups. They're very important, especially for patient education. The next C is cost. So the cost is different from the price. The price is the listed price versus the cost is the effective price paid. So this is the effective price paid by the patient and the payer. So let's look at an example. So the cost of treatment for Array before rebate is $19,000 per patient per year. But what happened is J&J offers $8,000 rebate to patients. So actually it's only $11,000. So who pays? So basically the patient is going to pay out of pocket 30%, so 3,000, and the payers are going to cover the remaining, which is 70%. Which kind of leads us to the next question. So who's making money? So the hospitals are actually making most of it, so around 60% of the value, and J&J is making 40%. The next C, convenience. How does Remicade convenience compare versus other anti-TNFs? Well, it's actually less convenient because, for example, in Array, you have to administer it with methotrexate. It's also an IV injection, so you kind of have to go and spend a few hours at the physician office. So you have to take an appointment. It's just much more cumbersome versus a self-injectable Humira or Enbrel. So the last T is the communication. So basically, Remicade views physicians as consumers. It's a pretty much a consumer-centric model. They try to show Remicade as a human brand, and they're playing a lot on emotions. So let's look at some examples. So overall, the ads demonstrate a good understanding of the patient journey. So as you can see here, it's self-explanatory. So those are print ads for Crohn's disease. But they also make the consumer aware the problem is treatable, and they encourage to request specifically Remicade. So let's look at those ads for psoriasis. So let me read you this. At this moment, should try anything. So why not consider everything? Or this one. It's disgusting that some dermatologists won't consider all their options. Or this one. Her sister's wedding is just weeks away. Who do you think is more anxious? So these print ads were rewarded by the Medical Marketing and Media Association. Judges were moved by the black and white nude shots depicting the anguish of severe psoriasis sufferers and positioning Remicade as a human brand that should be administered earlier in the regime. They described the campaign as dark, dramatic, powerful, emotional, and horribly beautiful. So communication was one of the key elements that made Remicade successful. But we also need to review one important point, one important element, which is the value proposition. So what are the competitive advantages of Remicade versus other anti-TNFs? Well, first of all, it has really strong medical credibility because of the extensive clinical data, over 20 years, over 2 million people. But also because physicians are so familiar with the drug. It has been on the market for over 20 years. It's considered as a gold standard in Crohn's disease. And plus, it can be used across many indications. Then, it has actually better reimbursement position for patients than other anti-TNFs because it's part of medical benefit, basically because of the IV injection, and it's not part of the pharma benefit. And then Remicade is on Medicare on Medicare Part B, not Part D, as other anti-TNFs. So it just makes the drug much more affordable for many people. And finally, it actually, because it's an IV injection, it just allows for a faster relief of symptoms, especially in RA. So now we are ready to review the cell strategy. Let's start with the basics. So what are cells? Well, cells equal the number of patients multiplied by the quantity used multiplied by the price per treatment. So let's go one by one and review the key drivers behind each of these variables. So first, the number of patients. To increase the number of patients, well, basically you can increase the number of your patients covered, either through new indications or through new geographies. And well, of course, you need to reach those patients. So you need to make sure that you reach physicians through sales reps. But also you need to make sure that you're on the hospital formularies and that you get good reimbursements. So the second variable in the formula is the quantity used. So basically, to increase quantity, you want to capture patients earlier. So basically, you capture more of the patient life value. And what you also want to do is you want to increase the quantity used. So, for example, the dose escalation in array is one of the way to increase the quantity. And finally, in the sales formula, the price per treatment. It's key to lock good reimbursement for patients, as you know, this is the only way that they have access to the drug. And you know, you can also give them rebates, as we have seen earlier. But the key is really the managed care strategy. So let's maybe look at this in more details. So managed care markets. So Remicade is covered by most insurance plans, as well as Medicare and Medicaid. There is a pre-authorization needed. It's covered under medical benefits, which allows for better reimbursement than other anti-TNFs. And on Medicare, it sits in Part B. We have already seen this. Very quickly, unique tools that are used to differentiate Remicade. So we have already discussed about the Anser test, which is commercialized by Prometheus Laboratories. And basically this test cleared the Remicade antibody, the chimeric antibody disadvantage by showing that people on Remicade produce just as much antibodies as when they are on Humira. Then another tool that is used to differentiate Remicade is the really good reimbursement assistance that J&J gives to patients. Innovative uses of social media, we haven't found anything that you know is very different from competition. J&J organizes information sessions for KOL bloggers once a year at the headquarters. They help advocacy groups to develop content, but that's about it. So this is it for my part. So now let's listen to Yang for the final comments. Thank you very much.